Hi, I'm Skylar Pond. I'm owner of Excellence Chiropractic. I'm a sports medicine chiropractor. You've already seen a couple demonstrations of how you can use foam rollers and things of that nature to help with knee pain, hip pain, joint pain in general. Now, if you've tried that out and it hasn't worked for you, this is the next step as far as therapeutic levels go. So this uses a lot of those pressure components, but it also adds in an element of friction. So these are Graston technique tools, and I'm an advanced Graston technique practitioner, so I've got these tools. Now this is what I do with them. The way these work is each one of these tools has a beveled edge. This is an adaptation from a very old technique called gua sha, used in Asia for 10,000 years. For the last 20 years or so, it's been refined and found the best materials, the best angles, the most clinical applications, been researched, studied, now it's on all the insurance panels. It's basically been westernized. We have great protocols to get great results with this. What we use this for is either chronic or acute injuries where you have tissue fibers that aren't aligned well. So that can happen either from an old injury that you had a very long time ago, or from a chronic disuse such as sitting down way too often, or it can happen from an acute onset, right? So what's really useful about these tools is they can be used therapeutically very effectively by breaking down disorganized tissue, fascia, muscle, whatever it is, or you can use it diagnostically. Because if you go over an area and it's super smooth, then there's nothing to do there. If you go over an area and it's rough and textured, you notice that?
Yeah.
Yeah. Then there is something there. It basically works in a similar manner that if you've ever painted, we've done a lot of build out around here, if you paint around a window and you get a little flecks of paint on the window and you go over that with a razor blade, it catches on those little bits of paint and disrupts them. That's what this is doing as well. So the way you do a simple Graston scan around a knee, I'd just be checking all the edges around the patella, looking for disruptions in the muscle and the fascia tissue. So I found a couple areas that are interesting, areas that are catching, and they'll also turn red too. It's like a leaf pressing, so it's objective. I like that. The patient can see it, I can see it, we know there's something to do there, and then we get into it. So the way we'll do that next is I'll have you go ahead and stand up, Hannah. And I'll use a little bit of coconut oil from emollient here so it glides over, it's a little more comfortable. Now give yourself a little bit of room because I'm going to have you back step lunge with this leg. Good, and back up, and back again, and back up. So now this is treading on the water of ART a little bit, so now this is a bit of an ART technique with a Graston overlay. So go ahead and step back again, slowly now. It's going to be a lot of resistance. So this does a good job of engaging the muscle and separating the different components of your quads. So we have a little bit of an overlay here between your rectus femoris and your vastus medialis. And by engaging like this with the overpressure, we're able to separate those and disrupt that subtle buildup of scar tissue that we found here. So if you've been using foam rollers, if you've been using lacrosse balls, if you've been having some success but you have lingering knee and joint pain with use, then look up a Graston practitioner.